Hi, Dr. John Erickson here again. Today we're going to talk about neurological disconnect syndromes as they relate to ADD and ADHD. A neurological disconnect syndrome is a situation that happens where the various areas of the brain, or the right side and the left side of the brain, are not in communication with each other. We know that all the parts are there, the frontal lobe, the parietal lobe, the temporal lobe, the occipital lobe. However, the connections and communications don't exist. And so as a result, we have an imbalance. Now, as a result of an unbalanced brain, many children are given medications. And the more popular medications would be things like Ritalin, Adderall, Concerta. All of these medications are designed to do one thing. They're designed to manage and cover up the symptoms that your child may be dealing with. What is important to realize here, though, that taking medications does not fix the neurological disconnect syndrome. It does not reconnect or reestablish the connections of the brain. It simply suppresses and covers up the symptoms that you may be dealing with that are undesirable, that are associated with the ADD, ADHD, etc. Once the drugs are stopped, the brain reverts back to the state it was before the drug regimen was begun. It's not fixing the problem. Now, on top of that, Ritalin in particular has some very serious side effects. Short-term side effects for Ritalin can include loss of appetite, decreased growth, tics, visual disturbances, nervousness, insomnia, depression, social withdrawal, irritability, abdominal pain, increased heart rate, and psychotic-like symptoms. Wow. Some of those actually sound like the condition itself. Now, unfortunately, long-term side effects have not yet been discovered, but it makes one wonder the impact that these particular medications may have upon the heart, on the kidney, on the liver, or even the immune system. Now, one of the important side effects of Ritalin is that there is a 500% increased risk of cardiac failure. I bet you haven't heard about that. And if you have, you don't hear about it much. Every child should have their heart evaluated prior to being prescribed Ritalin, for the simple fact that there is a 500% increased risk of cardiac failure due to taking Ritalin. Dr. John Erickson here saying, have a wonderful day. Hope this little bit of information was good for you and caused some thinking. Again, what we talked about today was neurological disconnect syndromes and their medications. Dr. John Erickson saying, have a great day. We'll see you later.